Hello, this is Gambia 24 with me, Sana Tunkara. Let's look at our news bulletin. UDP leader blames the government for the surge in COVID-19 cases in the country. Vehicles impounded by the police for plying the road with all number plates. Gambia's health officials express concern over low turnout by non-communicable disease patients at hospital. These and more coming up on Gambia 24. Stay tuned. Welcome back and thanks for joining us. The plan to reform the Serekunda General Hospital into a COVID-19 center with effect from August 24 has suffered a setback. The transformation will not happen anytime soon until certain measures are put in place according to hospital authorities. Omar CC reports.
A rise in coronavirus cases in the Gambia prompted the need for additional space to admit patients. As a result, the Serekunda Hospital in Kanifing was identified for use. However, the hospital's chief executive officer said this will not happen until certain adjustments are made. Keba Mane told iAfrica TV via phone that the hospital structures need adjustment and that there is not enough space for the easy flow of patients. He also said the hospital staff lack training on infection prevention control (IPC) to be able to handle new patients. He said these are obstacles that have to be addressed first.
We need to have the A&E where definitely the positive cases will be reporting to. They need to be tried there and then now moved to the ward where they are supposed to be admitted. So all that readjustments in the A&E, in the admission wards, needs to be done before we can start. So otherwise, we are trying to run away from having our staff infecting themselves.
According to Mane, the Serekunda Hospital also lacks some materials like respiratory machines for patients with severe symptoms like shortness of breath.
We have a lot of other equipment that needs to be in place before we can start as well. Oxygen supply is number one, which is very important in COVID management. So we have to see how best we can make sure there is consistent supply of oxygen for cases when they come, those who will need oxygen. So they consume oxygen at a higher rate.
Turning this hospital into a treatment center would have a huge impact on the people as Edward Francis Small Teaching Hospital and Medical Research Council are used as treatment centers. Thousands of people in the Greater Banjul area who could not afford to go to private clinics rely on services of the Serekunda General Hospital. Opposition leaders said on Sunday that the decision to turn this major hospital into a treatment center was a bad one. For Africa TV, Omar Ahmad Toure.
From a report by Omar Toure, on the occasion of the 23rd anniversary of the United Democratic Party, the party's leader Ousseynou Dabo has launched an attack on the government of Adama Barrow, saying he has failed on its fundamental duties to help the citizens confront the deadly coronavirus pandemic. Dabo, who is the Secretary General of the United Democratic Party, said the government wasted money on measures that weakened this health sector's strength to contain the virus. Detail in this report by Ibrahim Akidi Sonko.
The Gambia opposition leader Ousseynou Dabo said the government of Adama Barrow has failed on its fundamental duties to help the citizens confront the deadly coronavirus pandemic. Dabo, who is the Secretary General of United Democratic Party, said the government wasted money on measures that weakened the health sector's strength to contain the virus when he spoke at UDP's 24th anniversary on Sunday.
At the leadership and strategic level, the government has failed miserably to plan and execute an effective and comprehensive approach to this deadly disease. It wasted time and resources on bureaucratic half measures that has taken much needed resources from hospitals, patients, equipment, and frontline workers.
Last week, the Gambia government said it was converting a major hospital which received hundreds of people daily into a COVID-19 center. The decision to make the Serekunda General Hospital in Kanifing a COVID-19 treatment center was due to a rapid rise in confirmed cases and deaths, according to the government. However, Dabo, who is the country's former vice president, said this was a bad decision. He said the government should have used ex-President Yahya Jammeh's air-conditioned tent instead.
The recently announced decision of designating the Serekunda Hospital as an exclusive COVID-19 treatment center risks jeopardizing access to health care for a large number of a large number of patients that rely on this facility for the treatment of non-COVID illnesses at a time when our already overstretched health facilities have difficulties coping with their existing patient loads. The net result would be denial of easy access to medical care for treatment of other illnesses. A better alternative would be to release to the Minister of Health the big air-conditioned tents that Yaya Jammeh purchased from funds currently sitting on State House grounds and position them at suitable locations, properly equipped to be used as a treatment center for COVID-19 patients. It can accommodate a large number of patients and their caregivers with some augmentation of materials and other resources.
Madi Sise, the National Assembly member of Serekunda West, also an opposition figure, agreed. Honorable Sise, a UDP member, said converting the Serekunda hospital into a COVID-19 treatment center was never a wise decision.
I do not welcome that idea because the Serekunda hospital is a major hospital in the region, in the country. And there are a lot of patients there. So turning that to a treatment center would be it's difficult because you cannot, what are you going to do with the patients that are there? So for me, my take on that is I do not welcome it. I think what the government should have done was to create special treatment centers because there are enough money that has come into this country to fight COVID. So if government is not able to create a special center, then they are not serious with what they are doing with our funds. They don't have no justification to turn that to a COVID treatment center. There are enough funds to create one special.
Meanwhile, as COVID-19 cases continue to rise, the Gambia government is seeking to learn from neighboring Senegal for a better response to the pandemic. Reporting for iAfrica TV, I am Ibrahim Akebi Sonko.
Moving on, officers at the Wellinger police station on Monday impounded several vehicles that are plying the road with all number plates. Last year, the Gambia police force introduced new number plates for both private and commercial vehicles. The aluminium number plate is said to possess modern security features and last longer. Failure to comply with the rules, Ibrahim John tells us more.
Some drivers faced interruption in their work on Monday after police impounded their vehicles for failing to secure the new number plates. Speaking to iAfrica TV on Monday, Bakari Dabo, a driver, said he is aware of the new law, but he thought that was put on hold due to the coronavirus pandemic. He said today's operation came as a surprise to him and many other drivers because the date for the enforcement of the new number plates was not communicated to them. They have said it, but when the corona came, they stopped. For today's operation, I am not aware. I woke up and my boy told me the police seized our vehicle because of the new number plate. Now we are here waiting to hear what they will tell us. Nuha Sow, a commercial driver, said the information they gathered earlier was that the changing of number plates is limited to vehicles with rusted or broken plates. The unhappy driver stated that the police could have informed them prior to their operation to avert such a situation.
You understand? Because ntonga mi moy nun commando wala number plate o enyanta change la number plate o mi ala ko commandalo wala mi ala ko akatitale enyanta ko wala change.
What we heard earlier was that rusted and broken number plates are the ones to be changed. About 4 months ago, that is what they said. Today, they just decided to say drivers have to change their number plates to the new one. Many vehicles here haven't changed their plates. The clients are here suffering. Drivers are suffering as well. iAfrica TV contacted the police spokesperson, ASP Lamin Jai, who promised to get back to us regarding the matter, but he was inaccessible when contacted for the second time.
Now, former Vice President under Barrow's administration has confidently manifested that his party is the strongest in the country. The leader of the United Democratic Party, Usainu Dabo, said his party will emerge victorious in the next presidential, parliamentary and local government elections. He made this revelation at the celebration of UDP's 24th anniversary. More in this report.
The UDP, which was the biggest challenger to dictatorship, shaped the polls in the 2017 parliamentary and local elections. Dabo, its Secretary General since inception in 1996, said he was confident his party will win the 2021 polls when he spoke on the occasion of UDP's 24th anniversary.
I want to tell you one thing, and I want you to take this to the bank. The presidential election that is coming in 2021, UDP is the winner.
Dabo's position on the upcoming election was re-echoed by Madi Cisse, the National Assembly member for Serekunda West. Honorable Cisse said the yardstick to measure the party's chances of winning the next elections could be found in its recent successes in previous polls.
It does not need to be a rocket scientist to be able to predict that. Every political party, you must have a baseline to make your predictions. The baseline for the United Democratic Party is that we've been here for 24 years. We have our structures all over. And in the last political election cycles, the local governments and the parliamentary elections were fought on partisan tickets. And UDP took the lead in all these two important elections. So that's a benchmark for us to make a prediction. Nobody can doubt that.
The United Democratic Party is seen as the biggest political party in the Gambia. During the previous dispensation, it challenged and failed to win against Dictator Yaya Jammeh in 5 elections, all of which contested by its Secretary General, Ousainou Darboe, while the UDP's recent successes put it an edge over the other political parties. The question lingering in the minds of Gambians and political pundits is, can it replicate that successes in the December 2021 general elections? Reporting for iAfrica TV, I am Ibrahima Kebi Songo.
Now from political arena, health officials in the Gambia are worried at the low turnout at treatment facilities by non-communicable disease patients. This is because diabetes and hypertension patients are afraid of contracting the coronavirus in their respective treatment facilities, according to officials. This is a files in this report.
In 2017, Gambia's Directorate of Health Promotion and Education set in motion a 3-year project aimed at reducing the prevalence of non-communicable diseases like diabetes and hypertension through awareness raising. Officials monitoring the progress of this project found out in July a significant drop in the number of diabetes and hypertension patients reporting to treatment facilities. According to Sefo Singate, a senior program officer at the Directorate of Health Promotion and Education.
The challenges we are facing with regards to the implementation of the project, one is that people, especially those that are attending the clinics, are not reporting to facilities because of this fear that, because of the fear of the virus. So this is why during the when we first registered our first case, this was in March. From March up to May, June, when we last visited these facilities for supervision, I think in July, we realized that clinic attendance was very poor during that time. Not many people were coming to attend the clinics because of the fear. So what we do is we talk to the facility, the heads of these facilities, the CEOs and the officer in charges, to see how best we can make sure the clinics continue running, because in the registers they have the numbers of all these patients that are attending, and they give them appointments. The date is there, the time is there, so they have their contacts.
Despite the awareness creation, non-communicable diseases are increasingly becoming a serious global public health concern, including the Gambia. Singate said this government project was meant to create awareness and increase access to information on prevention and care of diabetes and hypertension, and to train healthcare providers on their prevalence.
The Diabetes and Hypertension Awareness Project started in 2017, but the unit, non-communicable diseases unit, was established long before the project. The project is just one of the areas where the unit is intervening in, and the aim of the project is to raise awareness on diabetes and hypertension prevention and management in the country, and also strengthen health facilities to manage diabetes and hypertension in terms of capacity and also in terms of other materials, some few materials like machines and strips, glucose strips.
The WHO standard profile highlights that the current prevalence of diabetes and hypertension in the Gambia is at 6 and 12% respectively. Despite the numerous interventions in controlling these diseases, there is a noticeable increase in the number of patients affected. For iAfrica News, DCC.
From that, moving on to our latest COVID-19 update, the Gambia has registered 148 new cases on Sunday as the number surged. The country now has a total of 2,685 COVID-19 cases. 3 more people died of COVID-19 on August 23rd. So far, 87 people have died from the virus since it was confirmed in the Gambia in March. While the Gambia recorded a total of 478 recoveries, there are 2,108 active cases. The Ministry of Health said the bulk of the active cases are asymptomatic and are self-isolating at home pending the manifestation of symptoms. Well, with that brings this edition of Gambia 24 with me, Sohna Tunkara, to an end. Please join my colleague Ibrahim Gay with the news in Wolof in half an hour. Bye.
Mon kontaan bo mu ne boy nga nyim bata mu be taki tubabu du boy nga nakko do mu be do ku boy ngaki na nyin kendi moy boy pura e bungulo nyi boro na bungo hani lento am futaje boy de jibe lu njumala ya fuñe koy babul lola ama me ila bungo jibe abadane jara foyte lafta fula nyi mam baluwo karam mu baluwo fo baluwo ko burlo ko fanan kele boy nyim bungo jala be nyamente abbe mu baluwo la do ko
ñin kunna soniyata ta www.baluwo.com anin baluwo isela bulloran jorangol be sang anila kudola asatare mambata jorangol membu ko sementol kenyo babarol nil peruol woni nga nyon jamal ta baluwo.com yin jorangol be sang ila dinkira bado adungite batala je anin baluwo ifangole marate la kudola.